Obviously, we want feedback from your company. Are you able to put together a preparedness plan? Have you done it? And if you haven't, why haven't you done it? We're asking a third and final poll question for our webcast. Which policies does your business have in place? A, stay home when you're sick, and that's really your policy. B, tell employees the status of the pandemic and how they should stay well. C, do you have employee rotation or cross-training to cover some of those critical jobs that Patrick Sheehan was talking about? Or D, have you done none of these? That's our poll question. Remember, click on the choice that fits your business, then click on Submit. And now we go back over to Bill Doyle.
Thanks, Bill. I'd like to introduce Nancy Stefani. Nancy is Emergency Services Coordinator at Century Health in Findlay, Ohio. The Century Health is a behavioral health agency. Now, Nancy, we've heard about employee absenteeism, need for people to take and fill in for other people. This seems very, very stressful. Could you address some of the mental and psychological issues that may come up with employees?
It's incredibly stressful for employees. They're torn in many different directions. They're worried about what's going on at home. They're overworked and stressed out at work. And this can result in a lot of different manifestations: physical, cognitive, emotional, and psychological. They can be more irritable. They can have anger outbursts. It can really make for a very stressful work environment.
Now, given that, what kinds of steps or effects could you see, or would you advise companies to put in place to assist people with these kinds of issues, both during and following a pandemic event?
I think they need to make sure that communication is very clear, and they need to communicate in multiple ways. Memos, emails that are sent out to everyone, lots of support and lots of communication over and over again. One of the effects of stress, that adrenaline rush, that fight or flight, is that cortisol is released and your short-term memory goes out the window. That can be very distressing for employees. They think they're going crazy, they're losing it, and they're not. You just don't need a memory to run or to fight. So having pads of paper so they can write notes and keeping communication up on a regular basis is very helpful and very reassuring.
It's interesting you say that. Stress can be chemical in the body, but I wonder about the emotions involved with a pandemic. Do people go through stages of depression when something like this happens, or is it simply fear? What are the mental emotions that you have?
Well, a lot of people are going to be going through grief stages, especially if they're losing someone.
Correct.
And the stages of grief are denial, bargaining, anger, depression, and acceptance. It's kind of like an onion. You go through it over and over again. And then if somebody else dies, you're doing it again and again and again. So it can be very stressful.
Given all these stresses, Nancy, and again, in the development of the plan, what kinds of things can businesses do? For example, identify people like yourself and your agency and others. What kinds of things can they do?
Lots of companies have employee assistance plans. If they don't, they could check with their health carrier to see if that's available to them, that offer lots of information like this. We have sheets. The message we want to get out to people is if you have any of these symptoms on this sheet, you're having a normal reaction to an abnormal event, because obviously pandemics are few and far between, and to identify those supports that are in place.
Well, we want to toss to another piece of tape from the fictional town of Cadmill, Ohio. And what we're finding out is that preparation is the key. Carrie Wilson now shows us another Cadmill company that they thought were well prepared for a pandemic, but soon found out that they were really quite vulnerable.
Metro Laundry is a local dry cleaning company, and like almost every other business around here, they felt the brunt of the pandemic, both personally and financially. And since they're a laundry, they soon realized that every article of clothing that arrived at their retail location or at the nearby commercial cleaning plant could be a flu carrier. But Metro was a little ahead of the curve. They had taken important steps to protect their business. While things got tough, the preparation and quick reaction kept a dire situation from getting much worse. At Metro Laundry, we spoke with the plant manager, Steve Willis.
Metro Laundry is a company that provides linen supply and dry cleaning services to a large number of clients across 3 states. We have 3 locations, 2 retail, 1 commercial, which also provides embroidering services. Our clients range from individuals to commercial uniforms and floor mats, as well as linen supply for restaurants and hotels. When the pandemic hit, our business slowed dramatically, especially our retail locations. What worried us most when the flu hit was that our employees were being exposed to soiled clothing that could possibly spread the virus throughout all of our locations. We made sure that anyone who showed even a few symptoms stayed at home. In order to keep our employees safe, we had done some prior planning for emergencies like this, but probably not enough. But we knew who was most at risk in our company. Our drivers were particularly at risk because of their exposure to the public as well as soiled clothing.
Another employee who was at greater risk was Lucy Collins. Lucy works the counter at Metro's walk-in laundry dry cleaning store and sees dozens of customers every day. How did the pandemic affect the business at the store?
I've never seen business go down like it did then. When people are sick, sometimes for weeks, they don't bring in a lot of laundry. So, to be honest, even when our store traffic was okay, a lot of our staff was out sick, so we couldn't really take care of our customers. I mean, most of them came back. Some didn't, I guess, but.
So, why did customers avoid the store?
I guess customers stayed away because they thought their clothes would come back with flu on them or something like that. I mean, that can't really happen to clean garments, but they don't know that, so.
Now, did you catch the flu?
Yeah, a lot of people got knocked down. I got the flu pandemic. I guess working with people's clothes, it was bound to happen. But Metro, by the time I got back, they had put in enough, took enough steps so that there were safety precautions, like we had a lot of hand sanitizer and things like that.
We told our employees to wash their hands whenever and wherever they could.
I started washing my hands like 100 times a day, and I still do have it, I guess.
What other steps did Metro Laundry take to protect customers and employees?
Something that helped out was our cross-training.
We trained individuals to handle more than one job so that if someone was absent, then they could immediately fill in.
So, for example, when I got sick, one of the other managers was already sick. He was in the hospital, in fact. He was much more sick than I was. But we had employees at our plant that could come and work the customer desk. So that kind of helped us cover our bases.
How may I direct your call?
It's been 8 months since the last round of the flu. Our business has been down, but we're slowly coming back.
It could have been better, but it worked out okay. We're still open, so I guess.
Very interesting what she said there. Could have been better, but obviously without their preparation could have been a whole lot worse. Poll question 3, your responses. We asked this question: which policies does your business have in place for a pandemic? Bill, what are people saying?
This is really interesting, Bill. The most common answer, roughly 40%, is employee information, status of pandemic, and how to stay well. That's very important. The second most common answer, 32% roughly, employee rotation and cross-training to cover those critical jobs. Yeah. And that's what we have been talking about. That's very, very good. 17% indicated that employees would stay home when they're sick. And then we had roughly 12% didn't have any of those. So hopefully the template, again, can be helpful for those in that category.
Which is exactly why we're doing this
webcast.